Hello, and welcome to Obstetrics and Prenatal Care at Emory Healthcare. We're excited to see you for your new OB visit. During this time, we are going to guide you through what to expect during your pregnancy journey and provide you with crucial information to help you navigate this new and exciting time. It will be helpful for you to have your guide to pregnancy book to refer to during this presentation so that you will be able to find this information later. The book is available as a PDF on our website, and you will receive a hard copy at your upcoming visit. Please sign up for your MyChart patient portal. MyChart is the best way to connect with your care team for non-urgent matters, as well as keep track of your healthcare. You may have received an invitation to create your account through text or email after scheduling this visit. You will also be able to schedule additional visits with your OB team in MyChart. You may receive messages to fill out questionnaires. Please complete the surveys as they help us take the best care of you and prepare for your visit. There are 5 locations for you to choose from for your regular OB visits. You will see these listed here. When it's time for delivery, you may choose from one of our 3 labor and delivery locations. Each labor and delivery location is staffed by our Emory faculty physicians who rotate through 12-hour call shifts, so somebody is always there. Several things will be done during your first OB visit. A team member will review your medical and family history and identify significant risk factors for your pregnancy. Your healthcare provider will give you guidance on what you can do to help ensure your pregnancy goes smoothly. Blood work will be done, and you will have an opportunity to have any questions addressed. It's helpful to write these down before your appointment. An ultrasound may be done to establish an estimated due date. The ideal time for a first OB ultrasound is after 7 weeks gestation. Consider postponing your first appointment if it's scheduled before that date. By postponing your first visit to 7 or 8 weeks, we can provide clear guidance on your due date. A trimester lasts for 3 months. During the first and second trimesters of your pregnancy, we will see you in one of our outpatient offices every 4 weeks. After 28 to 30 weeks, we'll see you every 2 weeks. In your last month of pregnancy, we will see you weekly. You can always refer to your guide to pregnancy to see when you may have specific lab studies or immunizations recommended to you. You will have at least 2 ultrasounds in one of our perinatal centers during your pregnancy. These appointments will be made by the perinatal center. Once your provider places an order for an ultrasound, the perinatal center should reach out by calling within 2 business days. The first ultrasound takes place at around 12 weeks gestation. This visit includes measuring specific anatomical structures of your baby. You will also have the opportunity to screen your baby, yourself, and your partner for genetic risks. A second perinatal ultrasound takes place around your 20th week and involves a full survey of your baby's anatomy. Depending on your medical history, either your general OB or the maternal fetal medicine specialist may recommend additional visits. Emory is a learning institution. This means we will have students and residents of various education levels with us during the care process. This benefits you in that you receive the extra information that goes with a team approach. Your faculty physician is always present and in charge of your healthcare team. We also ask for your participation as we all work together. We will have more specific lectures tailored to each trimester in our Pregnancy 101 series, which you can access throughout your journey for more information. Welcome to Emory Healthcare. We recommend writing questions down between visits so that you can maximize your time in the office. Use MyChart to get in touch with your care team about matters that may come up between visits and require more immediate attention. Messages sent through MyChart will be sent directly to a nurse and will be answered quickly. If you need to contact us for an urgent situation, call 404-778-3401 and listen through the prompts until you hear urgent clinical concerns. If this is during clinic hours, which are from 8 a.m. to 5 p.m., you will be connected to a nurse. If your call is after hours, you can ask the operator for the OB doctor on call. A note on dental health. If you're overdue for your dental visit, go ahead and set up an appointment. It's important to keep up to date on your screenings because cavities and gum disease can worsen during pregnancy. A letter for your dental team will be in your OB packet. Take the letter with you to any dental visit. It provides clear information about what is safe during pregnancy. Let's talk about your lifestyle for a moment. A well-balanced diet is one of the absolute keys to a healthy life in pregnancy. There is more and more research suggesting that a poor diet can affect not only our health, but the health of children even after birth. Be sure to monitor your food intake, making sure that most of what you eat is proteins, vegetables, and fruits, while limiting your intake of processed foods. If you want to get a bit more in depth, we recommend nutrition.gov. They have a phenomenal meal building program called Super Tracker. Pregnancy weight gain is natural and to be expected. Weight gain during pregnancy can vary depending on factors such as pre-pregnancy weight, overall health, and individual circumstances. There are general guidelines that healthcare professionals use to monitor and advise pregnant women. Your healthcare provider can advise what the recommended amount of weight gain for you is at your upcoming visit. We recommend regular exercise during pregnancy. Maintaining regular exercise can help you feel better, have more energy, and have fewer aches and pains. It can also improve the labor experience. If you have been involved in a regular exercise program prior to pregnancy, continue this program. There really aren't any limitations on the types of activities or amounts, but use your judgment. As the pregnancy progresses, what you are comfortable doing may change. If a certain exercise becomes painful or awkward, change it or eliminate it from your routine. There isn't a heart rate limitation on exercise. Instead, use the scale of perceived exertion, aiming for about a 7 out of 10. This means that you feel like you are working, but can still talk in short sentences. You may lie on your back for exercises. If this feels uncomfortable, you may need to adjust the angle. You may also do abdominal exercises. Eventually, as your belly gets larger, these become difficult. At this time, you should probably stop abdominal exercises. If you haven't been involved in an exercise program, you may start one. Start slow. Or you may consider getting in a good solid walk most days of the week. Let's talk about your medications for a moment. Your healthcare provider will review your specific medications at your visit and make recommendations for which can safely be continued or recommendations for alternatives. Please consult your healthcare team before suddenly discontinuing any of your regular medication. Please see page 13 of your guide to pregnancy for an extensive list of safe over-the-counter medications and supportive therapies for the most common symptoms you may encounter during your pregnancy. If you have a cold or flu, you can take what you normally would take unless it contains aspirin, naproxen, or ibuprofen. Common brands of those medications include Bayer, Aleve, Motrin, and Advil. Make sure you read the label. If you are taking multiple medications, make sure you are not getting double doses of the active ingredients. You can also take all lozenges. Common drugs like acetaminophen, Tylenol, and Benadryl and Robitussin are safe. You can also take allergy medications like Zyrtec, Claritin, and Flonase. Please know that generic medications or non-name brand may be just as effective. If you want more detailed information, please talk to your nurse. We know that learning about breastfeeding early in pregnancy can help families successfully meet their feeding goals. The World Health Organization suggests that babies eat only breast milk for the first 6 months of life, and then for a year or longer as they start to eat other foods. Babies who receive breast milk have a decreased risk of SIDS, allergies, childhood obesity, and diabetes. Breast milk provides passive immunity and helps babies fight off infections. Even a small drop of breast milk benefits a baby. You can supplement breastfeeding with formula and still give them important benefits. We know that any amount of breastfeeding and lactation decreases the risk of breast, ovarian, and endometrial cancers in the lactating individual, as well as their risk for diabetes and heart disease. Lactation consultants are available for patients who are at a hospital. They can assist if you are having trouble. And our nurses are all trained to support you in basic breastfeeding needs. At Emory Healthcare, we encourage our parents to try breastfeeding, but we understand that every family's journey is a little different, and we support all choices. We're here to help. Talk to your care team if you have any questions, concerns, or need assistance.